Every 66 seconds, someone is diagnosed with dementia. That's over 1,300 people every day, slipping into a world where memories fade, names vanish, and even familiar faces become strangers. And most people believe it's all due to aging. But here's the unsettling truth. Aging alone doesn't account for the sharp rise in early-onset cognitive decline. What if the real culprit is much closer to home? What if it's sitting right there on your bathroom counter? Or hiding in your medicine cabinet? Pills that are approved, prescribed, and even encouraged by doctors, often without any warning about the hidden costs they carry. In fact, a 2023 investigation revealed that up to 99% of seniors are taking at least one drug known to impair memory, shrink brain volume, or accelerate the development of dementia, and most have no idea. Even more shocking, the pharmaceutical industry has known about these risks for years. But the profits? Too large to ignore. In this video, we're diving into the 9 most dangerous medications linked to rapid memory decline, ranked from the commonly ignored to the most devastating. And when we reach number 3, it might shock you how many people take it every single day without realizing the damage it's causing. Let's start with number 9, a drug you probably have in your nightstand right now. Number 9, diphenhydramine Benadryl. It's small, pink, and seems harmless. You've likely used it for a cold, allergies, or to get a good night's sleep. Diphenhydramine, better known by its brand name Benadryl, is one of the most widely used over-the-counter medications in the world. But what if I told you that same little pill could be rewiring your brain? Diphenhydramine belongs to a class of medications called anticholinergics. These drugs block acetylcholine, a neurotransmitter critical for memory, learning, and alertness. Without enough acetylcholine, the brain's ability to form and retain new information starts to break down. In young, healthy individuals, the effects may be short-lived. But in older adults whose natural acetylcholine levels are already lower, the impact is far more serious and far more permanent. Studies have shown that frequent users of anticholinergic drugs like Benadryl experience measurable cognitive decline over time. In one major 2023 study, seniors using anticholinergic medications had a 54% increased risk of dementia. MRI scans also revealed shrinkage in the hippocampus, the area of the brain responsible for memory formation. And here's the kicker. This drug is everywhere. It's hidden inside nighttime cold and flu medications, PM pain relievers, and sleep aids. If the label says nighttime or PM, it often contains diphenhydramine. What to do instead? For allergies, try non-drowsy antihistamines like loratadine, Claritin, or fexofenadine, Allegra. For sleep, explore melatonin, magnesium glycinate, or cognitive behavioral therapy for insomnia, CBTI. Never assume over-the-counter means harmless. This pink pill might be doing more harm than you think. Coming up, the pill millions take for heartburn, reflux, and ulcers, but it might be starving your brain of the nutrients it needs to survive. Number 8, proton pump inhibitors, PPIs. Nexium, Prilosec, omeprazole. They go by names like Nexium, Prilosec, and omeprazole. These are proton pump inhibitors, or PPIs, the gold standard for treating heartburn, GERD, and acid reflux. They've been advertised as safe, effective, and side effect free. But here's what's rarely discussed. PPIs may be silently interfering with your brain's fuel supply. These drugs work by drastically reducing stomach acid. That helps prevent reflux, but it also blocks the absorption of critical nutrients, including vitamin B12, magnesium, and calcium. Without these nutrients, your brain begins to suffer. In a massive study of over 73,000 seniors published in JAMA Neurology, researchers found that long-term PPI users had a 44% higher risk of developing dementia. The reasoning? A lack of stomach acid leads to poor B12 absorption, and low B12 is strongly associated with cognitive impairment, confusion, and mood disorders. But it doesn't stop there. Research has also suggested that PPIs may increase amyloid beta plaque accumulation in the brain, one of the toxic proteins found in patients with Alzheimer's disease. Even more concerning, many patients are prescribed PPIs for short-term use, but stay on them for years. They become dependent. Their symptoms return the moment they try to stop, leading doctors to prescribe even higher doses. What to do instead? Talk to your doctor about slowly tapering off your PPI. Consider safer acid reducers like famotidine, Pepcid, or explore natural methods. Smaller meals, avoiding trigger foods, elevating the head during sleep, and natural supplements like DGL licorice. These drugs may be helping your stomach, but at the expense of your memory. Up next, a medication for bladder control that's been quietly linked to one of the steepest rises in dementia risk ever recorded. Number 7, oxybutynin, ditropan. If you've ever experienced urinary urgency or bladder leakage, you may have been prescribed oxybutynin, also known by the brand name ditropan. It's part of a group of medications used to manage overactive bladder, OAB. At first glance, it seems like a reasonable fix. No one wants to constantly run to the bathroom. But this solution may be coming at the cost of your cognitive function. Like Benadryl, oxybutynin is a strong anticholinergic. But it's even worse. It crosses the blood-brain barrier more effectively than most, directly impacting the hippocampus and other memory-related areas. In a 2019 BMJ study, researchers found that seniors taking oxybutynin and similar medications had a 49% greater chance of developing dementia, especially when used for more than 1 year. What's worse is that many patients are never warned about these side effects. They assume that feeling forgetful or foggy is just part of aging, when in fact, it could be their medication. A safer alternative? Ask your doctor about mirabegron, Myrbetriq, a newer drug that works via a different pathway and does not affect acetylcholine. It's been shown to be safer for cognition, especially in seniors. Remember, bladder control should never cost you your brain. And next, the miracle drug for sleep and nerve pain that may be slowly dismantling your mental clarity night by night. Number 6, amitriptyline, Elavil. Amitriptyline is an older antidepressant that doctors now use for a surprising number of issues. Trouble sleeping? Try amitriptyline. Chronic pain? Try amitriptyline. Migraines, anxiety, fibromyalgia, nerve damage? You guessed it, amitriptyline. But there's something you're probably not being told. This catch-all drug is one of the most potent anticholinergic medications still prescribed today. That means it blocks acetylcholine, yes, the same critical brain chemical we've been talking about, and it does so aggressively. A 2015 study published in JAMA Internal Medicine followed 3,434 older adults over a 10-year period. They found that those with the highest cumulative exposure to drugs like amitriptyline had a 54% increased risk of dementia. And it didn't take sky-high doses. Even low daily doses over years had a compounding effect. This is the kind of medication that creeps into your daily life. You start using it for sleep, then you keep using it every night because it works. Over time, you begin forgetting words, misplacing things, zoning out during conversations. And it gets brushed off. That's just aging, they say. But what if it's not? Smarter alternatives? For nerve pain, duloxetine, Cymbalta, or gabapentin have shown good results with far fewer anticholinergic effects. For sleep, consider melatonin, low-dose doxepin, a newer, safer cousin, or CBTI techniques. Don't let a harmless sleep aid become a silent memory eraser. And now, an antidepressant that behaves like a brain fog bomb. Millions take it without knowing they've chosen the most dangerous option in its entire drug class. Number 5, paroxetine Paxil. Among all the selective serotonin reuptake inhibitors, or SSRIs, paroxetine, known as Paxil, is the black sheep. While most SSRIs are considered safe for long-term use, Paxil has a dark twist. It carries strong anticholinergic effects. Unlike safer SSRIs like sertraline, Zoloft, or escitalopram, Lexapro, paroxetine crosses into the brain and blocks acetylcholine receptors, disrupting memory, mood, and attention span. It's a chemical wolf in antidepressants' clothing. A 2021 review in Frontiers in Psychiatry showed that paroxetine users had significantly worse cognitive scores over a 12-month period. Seniors on paroxetine were 30% more likely to show early signs of cognitive impairment than those on other SSRIs. The American Geriatric Society has placed paroxetine on its Beers criteria, a list of drugs considered inappropriate for use in older adults. Despite this, many patients are still being prescribed Paxil for depression, anxiety, or menopausal symptoms. What should you do? If you're on Paxil, ask your doctor about switching to a non-anticholinergic SSRI, like sertraline or escitalopram. These alternatives have been shown to support mood without compromising cognitive health. Depression treatment shouldn't come at the cost of your memory. Up next, the most controversial class on the list, prescribed for sleep and anxiety, but potentially leading to permanent mental decline. Number 4, benzodiazepines, Xanax, Ativan, Valium. Benzodiazepines are some of the most prescribed drugs for anxiety, panic attacks, and sleep problems. You'll recognize them by names like Xanax, Ativan, Valium, and Klonopin. And at first, they feel like a miracle. They quiet the storm inside your head. They help you sleep. They make fear vanish, at least temporarily. But these drugs come with a massive catch. They're deeply sedating, highly habit-forming, and they slow down brain function over time. A 2022 BMJ study tracked over 8,000 seniors for 6 years. The results? Seniors who used benzodiazepines for more than 3 months had a 51% higher risk of developing Alzheimer's disease. The longer the use, the greater the risk. And the withdrawal? Brutal. Attempting to stop these drugs suddenly can cause intense rebound anxiety, agitation, confusion, tremors, insomnia, and even seizures. Here's the worst part. Many seniors stay on these medications for years, often without knowing how much they've dulled their thinking, weakened their memory, and increased their fall risk. What to do if you're on one? Do not stop cold turkey. Work with a doctor to slowly taper your dose. Non-sedating anxiety medications like buspirone or therapies like CBTI and mindfulness-based stress reduction can help you regain clarity and calm without shutting down your brain. The next group isn't just a memory problem. It affects personality, awareness, and even mortality. Number 3, antipsychotics, Risperdal, Seroquel, Zyprexa. Antipsychotic drugs were originally created for serious psychiatric conditions like schizophrenia and bipolar disorder. But today, these medications, Risperdal, Seroquel, Zyprexa, are often used in seniors to manage behavioral problems. And that's where the danger lies. These drugs suppress dopamine, a brain chemical crucial for motivation, emotion, and executive function. They dull patients into a kind of chemical quietness. But the price of that silence is high. A 2022 Lancet Healthy Longevity study showed that seniors prescribed antipsychotics had a 71% increased risk of worsening cognitive decline, even if they didn't have dementia to begin with. Even more shocking, the FDA has issued a black box warning, the strongest warning it gives, against using antipsychotics in elderly patients with dementia-related behaviors. Why? Because they increase the risk of stroke, sudden death, and extreme sedation. Families often describe their loved ones as zombie-like. Less emotion, less speech, less presence. Their bodies remain, but their personalities seem to fade. What to do? If you or someone you love is on an antipsychotic for behavior control, ask why. Request a care plan review. Many behavioral symptoms can be improved with non-drug strategies, structured routines, calming environments, music therapy, and proper pain management. Antipsychotics should only be used as a last resort for the shortest time possible. But what if the biggest danger isn't a single pill, but a stack of them? Number 2, anticholinergic polypharmacy. This is the hidden crisis no one talks about, and it may be the number 1 driver of drug-induced dementia in the modern world. Polypharmacy means taking multiple medications at once. And when those medications all have anticholinergic effects, the risks aren't just added, they're multiplied. Imagine taking Benadryl at night, oxybutynin for bladder control, and amitriptyline for sleep. Individually, each one slightly blocks acetylcholine. But together, they overwhelm the brain's memory circuits. A 2022 study in Age and Aging tracked over 280,000 older adults. Those with the highest total anticholinergic load had a 120% higher risk of developing dementia within 10 years. This means that even if you're not taking dangerous doses, the combination of your meds could be doubling your dementia risk without you or your doctor even realizing it. What to do now? Ask your doctor or pharmacist to perform a medication review. Use anticholinergic burden scales to identify which drugs overlap. Then create a plan to prescribe, substitute, or lower doses safely. Your brain is resilient, but you have to give it room to recover. Now, let's revisit a drug group surrounded by confusion, fear, and misinformation. Number 1. The PPI controversy revisited. Let's return to the PPIs: omeprazole, esomeprazole, lansoprazole. They made headlines years ago for being linked to dementia. But what does the most recent science say? Newer, better-controlled studies have shown that PPIs alone are unlikely to cause dementia in most people. The early studies didn't control for important factors like B12 deficiency, chronic illness, or other medications. That said, long-term use still matters. PPIs can deplete B12, magnesium, and calcium, and they should not be taken for years without review. So while PPIs are no longer considered the most dangerous, they're still part of the polypharmacy problem and should be used carefully. Key takeaways: use PPIs only when absolutely necessary. Get your B12 and magnesium levels checked. Reassess every 6 months with your healthcare provider. And finally, what can you actually do today? Closing, protecting your mind. The path to dementia isn't always paved by age. Sometimes it's built one pill at a time. But here's the good news: you're not powerless. With the right knowledge, the right conversations, and the right changes, drug-induced memory loss is often reversible. Start by reviewing your medications. Look for anything labeled PM or nighttime, drugs ending in zepam or zolom, older antidepressants, or bladder control medications. Then ask your doctor the magic question: can we reduce or replace anything on this list to lower my cognitive risk? You'd be shocked how many options exist: safer drugs, non-drug therapies, and simple lifestyle changes that can protect your mind. Now I want to hear from you. Are you or a loved one taking any of these medications? Have you noticed changes in memory, alertness, or personality? Drop a comment below. We read every one. Your story could help someone else find clarity, too. Stay sharp, stay informed, and stay tuned for the next video, where we'll reveal the top natural ways to support brain health after 50. Don't forget to like, subscribe, and hit the bell. Your brain is worth it.